Buenas and half a day to our listeners on Guam and in the CNMI. It's now time for Total Health right here on Joy FM Radio, where your questions get answered by health professionals. If you have any health-related questions, we would love to hear from you. Call your questions and comments in at 472-1111 or text or WhatsApp 686-9999. If you're in the CNMI, please call 323-1113. Welcome everybody to Total Health.
Well, hello everyone. Here we are again with more of Total Health. This year we're committed that we're going to bring those interesting topics that kind of is going to touch everybody, or those topics that you kind of want to know more about it, but there is not much information out there, or information is kind of confusing for us. I would think if I'm a patient, it will be very difficult for me to decide on internet what's right, what's wrong. And today our topic is quite serious, and we are going to talk about dementia. Before you think that this does not apply to you, I have a news for you. It does apply to all of us. And the way we live, I believe our speaker is going to give us a little bit more light on if the way we live can actually help us prevent dementia, or do we have anything to do with preventing ourselves, protecting ourselves from the grasp of dementia. I have today a very special guest, a new guest, and that's Dr. Jared Santana. Dr. Jared Santana comes all the way from Texas, and we are so privileged in our clinic, SDA Clinic, to have an internal medicine physician that he moved with his beautiful wife and 2 kids, and he is a permanent provider. Welcome, Dr. Santana.
Thank you so much, Elena. It's a pleasure to be here.
I know, and me and you, we kind of feel tomorrow already, right?
We do.
We feel like we belong here, and we absolutely...
I'm not leaving. I'm not leaving this place. I love it here.
Right? I love it too, and we are very excited, and we are very passionate about the health of our tomorrow friends, co-patriots,
Absolutely.
I would say.
Absolutely.
Yes, I even asked our dementia group on the island if they can tune in, and I will be hoping to hear more from you. If you have any questions, here we go. We have a specialist in lifestyle medicine. Dr. Santana is not only internal medicine physician, he has a very deep interest in lifestyle medicine. And I believe Dr. Santana can give us some good news today, in every stage of dementia, how we can actually help ourselves and those that we love with some prevention, with therapy, and you will say it more.
Absolutely. And looking forward to this.
Thank you. So, let's go deep in, like very deep, right away into dementia. Dementia, from Latin, it means actually when someone loses their own mind, losing your own mind.
Right.
Demens, from Latin. Okay, is that something that just happens? Dementia is out there to swallow whoever it can, or it's something that we actually can foresee? What is actually dementia, Dr. Santana?
So, an ongoing definition would be, the official definition would be like a decline in cognitive function, but that impairs your daily living to a point where the person is no longer independent, right? So, all of us, from time to time, will forget our keys, or we'll forget this, or we'll forget that. And, you get older and you think, oh, man, I'm getting dementia, or you call it Alzheimer's, right? Because you have only some dementia, some Alzheimer's, not all. But it goes further than that. The patients with dementia, sadly, are starting to slowly give up their independence. And that's really what the crux of it is. Memory loss is one sign, but there's other things, inability to feed yourself later on, inability to dress yourself, inability to find your way home. And those are all sad findings of this terrible, terrible disease.
So is it just one disease? Is it several diseases? Is it like a term? What is it?
So, when we talk about dementia is like the generalized term, but it actually overlaps a few diseases, and we have that as one of our questions today. Some of the common ones, well, the most common is Alzheimer's by far, and I'm going to talk a little bit about that in a few minutes. But there's also something called vascular dementia, where patients have these little strokes here and there, and it starts killing off parts, very crucial parts of your brain. And there's also something called Lewy body dementia and frontotemporal dementia, and I'm going to mention briefly in a few minutes what each one of those entails.
Yeah, I mean, I know that there are several dimensions out there, and I don't know which one comes to, different ethnicity, different personality, different ages. We kind of want to get a little bit more light on that. And why
Absolutely.
does dementia actually occur?
So several things happen. One of the things that happens is a term we call atherosclerosis. Basically, that's hardening of the arteries and the buildup of plaque. We've heard about this. It's the same problem that affects heart disease. We get heart attacks from this. We get strokes from this. And so what happens is that there's narrowing of the arteries, there's plaque buildup, and we start losing our brain cells little by little. And this is, if it happens in the memory center of the brain, this is what you're going to see. By age 65, also, it's important to remember that blood flow decreases by about 20%. So already beginning at age 65, you're already seeing a decreased blood flow, which is going to affect. And if you add on to that, you have a hardened artery, you have a stiff artery, you have plaque buildup, you have narrowing. You're talking about, a huge problem with Alzheimer's. The main issue, however, is the deposition of a protein. It's called amyloid. And so we see this in the autopsies, right? When we do them, we find this amyloid protein, but the amyloid is directly correlated to the amount of LDL cholesterol that we have in our body. So cholesterol plays an important role in Alzheimer's.
Wow, I thought it's just the amyloid, that it is coming out of nowhere. From what I know, it's a protein. Does it mean that we are eating too much amyloid in order to get that?
So basically what it's tied to is your LDL cholesterol, which is your low density lipoprotein, right? This is what we traditionally would have called the bad cholesterol back in the day. So it's, in a certain way, it's tied to what we eat, to our cholesterol levels. And there are many neurologists out there who are actually proposing that we call Alzheimer's a vascular disease, not so much a genetic disease. But we are going to talk about the genetics also on this talk. I'm looking forward to that. Amyloid is the issue, like we said. Let me say a little brief thing on genetics. This is interesting. United States, one of the highest Alzheimer countries, right? One of the lowest, India. What makes it different? Well, we're going to see that today. Another interesting thing is Japanese men in Japan have a low incidence of Alzheimer's disease, but you get Japanese men in America, in the United States, and their incidence of Alzheimer's increases. Same thing with the African American population. In Nigeria, very low Alzheimer's, but you get those same African Americans, you put them in the United States, and their risk of developing Alzheimer's increases. And it's no secret that since the 1960s, animal fat consumption in the United States has increased more than 600%.
Okay, so now I'm getting even a little bit more perplexed. Is it genetic or is it lifestyle related, like the way we live, the way we eat? I'm getting more confused, or is it both?
It's actually both. So I'm glad. That's a very good question. So, what the studies actually show is these studies were done in the United States. If you cut your intake of meat, and I know our Guam population might not like this, but that includes chicken and fish, you actually cut your risk of developing dementia in half.
Oh, wow.
Okay? So diet is playing a very, very big role. But, you mentioned genetics. Genetics is very important. Let's talk about genetics for a little bit. So the main gene that we're looking at is something called the ApoE3. That's E4 gene, okay? So if one of your parents, let's say, carries that gene, your chance of developing Alzheimer's is triple the risk. If one of your two parents has the ApoE4 gene, if both parents have that gene, you have a 9 times chance of developing dementia. This gene is actually what makes that protein that develops Alzheimer's. It carries cholesterol in the brain. Now, you're probably asking right now, should I get tested? In about 1 or 2 questions, I'm going to answer that question for you because I have some great information on whether or not you should be tested for the ApoE4 gene.
Yeah, I kind of really would like to know more about it. Like, is it like that the genetic, if my both parents have those genes, then what do? I just accept it that they, once in lifetime I'm going to get it? Or do I do something about it? But before I like to speak about that, Dr. Santana. We did get a call from a listener.
Sure.
And it might be a little bit difficult to answer that question, but I believe you'll be willing to try. Carol is asking, her mom suffered from dementia. She lived to be 100 years old. Well, she passed away from what I'm understanding, and she's asking if the dementia put her down or actually it was her heart.
Well, that's a very, very good question. And unfortunately for me to know for sure, I would have to look at her chart. But, let me try to answer that question in a generalized way. If you look at what the CDC says as causes of death, we all know the number one cause of death is heart disease. The number two cause is cancer. But if you keep going down the list, the number seventh cause, it's listed as Alzheimer's. So we get this question a lot. Do people die of Alzheimer's or do they die of something else? Well, depends on which neurologist you speak to. Because I think the consensus from the neurologist is usually once they diagnose Alzheimer's, you have usually less than a 10-year prognosis. But unfortunately, our Alzheimer's patients usually succumb to something else before they actually die from the Alzheimer's. Examples, they may lose their ability to swallow and develop aspiration pneumonia. They may die from malnutrition. A lot of them die from infections just because their immune system is depressed. So to answer our question here, it's kind of hard without looking at the medical records. We like to see what other chronic diseases were involved, but it can be either or. That's the short answer, Elena.
Yeah, I can see where you're going with that. Because many times we believe, dementia is there. It actually keeps you alive for a long time because you are not going through some of the struggles that, those that we have our cognitive function preserved, we go through. But we will hear more about that right after the break.
We're going into a short break. Why not call in your question on Guam, 671-472-1111, in the CNMI, 670-323-1113. We're streaming live on Facebook. Go ahead and leave a comment in the comment section below. You can listen live online, joyfmradio.net. We'll be right back.
Calling to see how you're doing. You getting enough sleep? Oh, how about groceries? You need any peanut butter? Cookies? Oh, how about some peanut butter cookies? I'll make some today and bring them by.
Listening to Joy FM is kind of like eating a warm batch of Mom's homemade cookies. Yeah, we're that good, warming you up on the inside. We're Joy FM. Find out how you can support us. Just log on to our website
at joyfmradio.net.
Si Joe Mossy, and thanks for listening to Total Health on Joy FM. We want to hear from you. Call in with your health-related questions at 472-1111. In Guam or in the CNMI, the number to call is 323-1113. Text or WhatsApp us at 686-9999. And now, back to the show.
Well, Dr. Santana, you were telling us about different countries and ethnicities and who is more prone to that. I'm just wondering on this geographical map where Guam is, or actually, which are the populations that are the most affected by dementia?
So, very good question. And since we knew we were going to come out on the air here on Joy FM, I did a little internet search, and I found an article that was published in Neurology magazine back in 2007. Check this out. The name of the article is called Prevalence of Dementia in Chamorros, right? And so this is what I want to share with you, because this is what's relevant to our population that's listening today, okay? In the Chamorro population, these are the risk factors. The top two risk factors: age, meaning the older you are, the higher your risk, and the other one is low education. In other words, if in our population who may have not completed a certain degree of education, we see a higher risk of Alzheimer's. And the reason for that is basically, the belief is the more time you spend in school, the more you stimulate your brain, right? So poor brain stimulation leads to a poor outcome. So check this out. Which factors were not associated with dementia in the Chamorro population? Gender. It didn't matter if you were male or female. There was no one that was found to be higher risk. And the other one is interesting. The other one is that gene, the ApoE4 gene that we just talked about, was not associated. It didn't matter if you were high or low. It didn't affect the results of the study. So in general, if someone here from Guam would ask me, do you think I should get tested? I would say, well, that's a personal thing, if you want to know what your risk tentatively would be. But overall, based on this study, it wasn't really that relevant. So I thought that was interesting. But I do want to share, and this is kind of the sad news, the prevalence in the Chamorro population is quite high for dementia.
It is quite high, and I don't know, I'm sure that there's some specialists that do have a saying about it. For many years, the Chamorro population were eating the Frederico nuts, the Ficus micronesica, which contains some cyanide, and those pancakes or tortillas that they will make it from that will cause them to have a condition that in maybe pidgin English, it will sound like lithocobotic, which means like paralysis of the whole body that comes as a result of eating those nuts.
Wow.
Yes, and I have seen it, and that was the first thing I learned about Guam, that they have this special type of Parkinsonian dementia that you don't see it anywhere else in the world, because the Frederico nuts are endemic to Guam, Palau, and some places in CNMI. I was able to find those nuts. I was able to wash them for 2 weeks, able to make the tortilla, and I can see how delicious they are and why the Chamorro people really, really like them.
Yes.
But in my practice, for the last 2 years, I have seen only one patient that suffered from that particular Parkinsonian dementia. So we don't have it right now as often. It's not that frequent, but we still have a high level of dementia. So what would that be? What can be the cause of our Chamorro population being high on that level? What would you say, Dr. Santana?
So, like I said before, we arrived in Guam 2 months ago, and my family and I just love it here, and I love it here, and I've been working already for 2 months at the Guam STA clinic, and I've been seeing lots of patients, and unfortunately, I'm treating a lot of high cholesterol. Diabetes, chronic kidney disease. So I see that we have a high risk for heart disease here on the island, a high risk for stroke. And so we have to think of dementia as using the same risk factors. Remember, we mentioned atherosclerosis. We mentioned that deposit of the plaques, of the cholesterol and the plaques. And I know here on Guam, we like to eat a very high meat diet. We like our barbecued pork, we like our chicken. And so I think, towards the end of our talk, we're going to get into a little bit of how to prevent this. We're going to talk a little bit more about the dietary factors. But I think one of the main things is our diet here on Guam.
Yeah. I think we have to face the reality. If
Right.
we cannot find the gene, we can conclude that it is related to our lifestyle. So can we say that dementia actually can cause death?
Yeah, we mentioned that. That was we had a really good question from one of our listeners, and dementia. Once you get diagnosed with dementia, you're looking at a decreased lifespan. That's what all the studies have shown.
So there is no way to kind of prolong it, like prolong the decline of the cognitive function, or once you're diagnosed, that's like a down spiral way.
So the whole idea behind it is that, once brain cells die, there's no way to revive them. So most of the therapies that we've tried to do in the practice of medicine is to slow the progression. Some of you may know the common medications we use. We use one called Aricept is the commercial name, but it has another name as well. And we use that one to try to slow the progression. It's donepezil is the generic name for that. And the whole idea behind it is you can't reverse the Alzheimer's, but we want to slow the progression. The Namenda is also another one that does the same thing.
Yeah, I also have read a lot of studies in which, for example, different plants are associated. Maybe they are not exactly preventing it, but they can prolong that cognitive
Right.
decline, like ginkgo biloba
Uh-huh.
that we have, from Japan,
Right.
available to us. So I kind of would like to hear more about it. But before that, tell us, how do we recognize that we are starting to have dementia? First symptoms of that early onset. How can we start questioning that? Because many times I'm losing my mind. I'm so occupied. I have too much on my plate. And I started thinking that I'm really losing my mind.
Right. So that's a great question. And what I want to say is, if you have someone that you suspect has dementia, as a family member, close friend, relative, accompany the patient to the doctor's office. Because, see, from a doctor's standpoint, we see that patient for 20, 30 minutes. We don't know exactly what their baseline is. The family knows, and they will tell us, Doc, he's forgetting this a lot, or she's, she got lost on a walk. She couldn't find her way home, or, she's having difficulty eating. She's taking a lot longer to eat or to get dressed, or she's saying some erratic things, or she's getting confused. These are all signs and symptoms. And we really, as physicians, we depend very, very heavily on the family. The family is key. They're the ones that tell us, Doc, this is not her. This is not him. Something's going on. And then at that point, the doc says, okay, well, let me do some screening tests in the office. And sometimes we do have to refer to neurology if we suspect dementia. Sometimes we want to classify it, right? Which type of dementia, because they may have different treatments and different things that we have to look for.
And what are those things that we're looking for? How do we classify it? How do I know, for example, that I have Alzheimer's or I have a different type of dementia?
So one of the first things would be memory loss. Okay. And I'm going to jump into the different types of dementia and talk just a little bit on each one and what symptoms we find, right? Because, one of the questions we get is, what is the difference between Alzheimer's and dementia and Parkinson's? And, and we want to know what that is. So let me start with Alzheimer's. Okay. We're going to just talk a few minutes on this. This is the most common, right? And usually dementia is a clinical diagnosis, meaning there's no specific blood tests that are 100%. There's no specific imaging that's 100%. They can kind of help you narrow it down as a physician, but usually it's a clinical exam. We do a little test in the office. We put them to draw a watch and to say some words and spell the word world backwards, things like that. That's called a mini mental assessment. Okay. Now, for Alzheimer's, you can do some imaging. There's PET scans that can spot those plaques that develop in the brain. The problem is most of these are not covered by insurance. And they're very expensive. So we kind of have to do a clinical diagnosis. But in Alzheimer's, what we're looking at is evidence of brain shrinking. And what are we going to see clinically? Memory loss, difficulty with daily normal tasks of life. That could be eating, sleeping, getting dressed, getting undressed, driving. Any alteration in that can be a sign of dementia, even confusion. Okay? I'm going to talk a little bit about vascular dementia. Vascular dementia is a little bit different. In vascular dementia, what's happening is there are some are larger, tiny strokes that are happening in different parts of the brain. And so there's different areas in the brain that are losing brain cells because they die off because of these little tiny strokes. Many of them you can't see on an imaging because they're so small. And so it's usually, we learned in medical school, this was kind of a stepwise approach. Mom could do this last month, but all of a sudden, boom, she can't do this. Or all of a sudden she can't speak this, or she can't do that. It's just kind of a stepwise approach, not so gradual as you see in Alzheimer's, right? Although they're very similar diseases because they're both considered by some neurologists to be vascular diseases. How many of you know who Bruce Willis is? Yeah, I think most of us know. Very, very famous actor, Bruce Willis. Very unfortunate. Bruce Willis has something called frontotemporal dementia. It affects people at a younger age. He was in his 60s when he was diagnosed, and it progresses very fast. These have a few other symptoms. I'm going to share some of those with you. They have trouble finding words. They have trouble speaking. They may even have trouble understanding you when you speak. They have uninhibited behavior. Okay, what does this mean? These are stories that you hear where, your loved one just dropped his pants because he had to pee in the middle of the mall, and you say, what are you doing? This is uninhibited. They're not fazed by it. They're not embarrassed by it. And you can see some of this behavior as the disease progresses. It's inappropriate behavior many times. And sometimes they can be super, super lethargic, like they're just falling into a deep sleep. And that's what happened, unfortunately, with Bruce Willis. It's not that common, but it's common enough that if someone does have, some stranger symptoms than the usual Alzheimer's, I would probably want to send him to a neurologist and have him evaluated. All right, here's another question for you. How many of you remember Robin Williams? One of the funniest comedic geniuses of our time, right? Made lots of funny movies. Well, Robin Williams developed what's called Lewy body dementia. This was a movement disorder, right? This is the Parkinson's symptoms. People ask about that. This is the dementia that's most likely related to someone with Parkinson's. They have that movement. They can't stop moving. These patients may have personality changes. And they can't, the family will say, this is not him or this is not her. They have trouble reasoning. They sleep a lot and they have mood changes. And the sad thing with Robin Williams, he actually had paranoia with this. He was paranoid. He got confused. And he had said in an interview years before that if he ever lost his ability, because how, those of you who are fans of Robin Williams, you know how fast he was with the comedy. If he ever lost his ability to be fast with his comedy and be able to do what he does, he wouldn't want to live. And many people believe that that's one of the reasons that he unfortunately committed suicide. So those are the four common ones that we see from a medical standpoint. There's Alzheimer's, vascular dementia, frontotemporal dementia, like Bruce Willis, and then Lewy body dementia, like Robin Williams.
That is interesting to know. So now I got a question about dementia. How can one approach care for a dementia patient?
How can one approach?
Yes,
Like
care.
different approaches. Like, what can we do once we know that our patients...
Absolutely.
Yeah.
Oh, I love that question.
Thank you.
That's a wonderful question. Okay, so number one, I just wanted to mention, because I know we're going to go on break in a little while, one of the things that I want the family to know is, and I actually got this advice from Bruce Willis's wife, Demi Moore, his ex-wife, and she said, we approach every day as if it's a new day, right? And so, and I know we're going to cut to a break, but I will answer that question when we come back a little further in the program.
You got a question about dementia or a question? You can give us a call on Guam. 671-472-1111. In the CNMI, 670-323-1113. You can text and WhatsApp your question in 671-686-9999. We're streaming live on Facebook, so go ahead and leave your comments in the comment section below. You can listen live online, joyfmradio.net. We'll be right back.
What are you doing?
Trying to move this budget.
You can't move it by yourself. I've tried.
But it's in the way.
Budgets have a way of getting in the way of our goals. But our budget won't budge without you behind us. With everybody pushing, giving just a little, we can move things along and concentrate on reaching our community with the good news that in Christ, we can all move mountains. Joy FM, joyfmradio.net.
A bird on the roof is not a problem, right? But move it a few inches and it becomes one. Because now that bird is in the attic. It's like using credit cards. Use them over and over and you'll start hearing the tweeting of the minimum payment here and the chirping of the late fee And before you know it, you've got a flock of sparrows in the roof, building nests in the eaves and dropping what they drop in the chimney. Then if something major happens, like a hole in the roof, then you'll really have a big mess. A bird in the house is pretty annoying. The Bible has a lot to say about the wise use of money. One thing is that God knows how to take care of sparrows, and that you are worth far more to Him than they are. It's a matter of trusting Him instead of the world to provide your needs. Each day is a chance to trust Him inch by inch, like the distance between the attic and the roof. Just a little reminder from your friends at Joy FM.
Welcome back. You're listening to Total Health on Joy FM. Call in with your health-related questions to 472-1111 in Guam. If you live in the CNMI, we want to hear from you too. Call 323-1113 or text or WhatsApp us at 686-9999. And now, here's more Total Health.
All right, so one of the last questions we got was, what is the best way for us to care for a family member with dementia? So let me share a few of the recommendations that we do in general medicine. I mentioned a couple of the medications we use. Unfortunately, some patients do require antidepressant therapy because they do go into a depression because they realize that things are not the way they normally are. One of the things I want to share with family members that we sometimes forget is to address the legal and the financial concerns. Because as this progresses, you may not be able to get that type of information that you need. I advise for a family member to establish themselves as the medical power of attorney. I think that's very, very important because then what happens, if that doesn't happen, you end up in the hospital and now something bad happens and we don't know what dad or mom would have wanted because we never had that conversation with them. That includes advanced directives like a do not resuscitate order. Don't try to figure that out in a stressful situation when your loved one is in the hospital in a critical state, and you can't ask them, hey, what would you like us to do? Would you like us to intubate you or do CPR if your heart stops? You want to address that early on and have it in writing so that you do not have to stress about that later. And it's best for the patient, right? Because we're doing what the patient would have liked. The other thing, and I know nobody likes to hear this one, Elena, but you have to address driving safety. Because there is a lot of people, unfortunately, who have dementia who should no longer be driving because they are a menace to themselves and also to other people on the road. The other thing I advise family also is think of the long term. I don't know exactly how things run here on Guam, but I know in the U.S. we have memory care centers and we have assisted living. And I think it's, if you have the money for it, you can afford that. For the rest of us, we have to usually take care of our loved ones at home. But what I wanted to say, and I was saying this, I got this, I mentioned Bruce Willis's wife briefly, but she said something that made sense to me. Have realistic expectations, just because if you don't have realistic expectations, I guarantee the family member will suffer probably more than the actual patient. Right. And so from there, we'll probably jump into what are things you can do once you have it, or more importantly, what can I do to prevent developing dementia? So we'll go over that, Elena.
Yeah, it is very important, and the way we live today, obviously, it's going to be presented later on. And you mentioned a few things that are very important. Early and in age, is important to engage our brain, get as much as possible education, but then later on, middle age, make sure your hypertension is well controlled, that you don't have diabetes or you control your diabetes. Dementia is called diabetes type 3, and that term is more broadly used nowadays. Yes, work on the diabetes, work on your, heart conditions, and then at a later stage, if you are depression for some reason, it kind of shrinks the brain, creates this, enormous brain fog, and it's much faster, to spiral down once you have depression. Loneliness, the fact that you are not having this social contact with others, or you're trying to isolate yourself because of, some cognitive decline that you have, is one thing that absolutely needs to be addressed right away. If you see someone that you love going in that route, let's engage them. Let's engage them in a very cognitive way, to learn as much as possible. Maybe they always wanted to learn Japanese. Maybe they can learn one word in a day, but let's stimulate the brain for as much as possible. The brain is there to be stimulated. You said that in the beginning that we need to bring the patient to doctor's office. How often do we have to bring the patient to a doctor's office once they're diagnosed with some type of dementia?
So initially, it might have to be frequently as we get the testing done. But once we've established diagnosis, I usually personally do about every 3 months in the office, because that'll at least give me enough time for the family members to determine, what, they're improving in their symptoms, they're going downhill quick in their symptoms. And because if you see them too often, you're not going to see much of the changes. So I think it varies from doctor to doctor, but I personally like 3 months.
Mm-hmm. Okay, that helps. Well, some of those things that I mentioned, like work on your brain, stimulate your brain, work against against loneliness, against diabetes. What else can we advise our listeners? What else they can do in order to prevent themselves going that route? Or once they're there, how can we slow down the progression of the memory decline?
Right. Great question. I think that's what we all are waiting to hear right now. So I'm going to share some information with you. The information is actually backed by scientific research, so it's not just hearsay. But in the studies, the researchers found that diets that are similar to the Mediterranean diets were very beneficial. Why? Because of the high vegetable, fruit, nut, and bean content, and they were low in dairy and meat. And so that diets that resemble more of the plant-based and less of the animal foods were definitely, hands down, shown in most of the research studies involving food and Alzheimer's. Let's talk about some specific foods. There are studies on blueberries, that blueberries can slow brain aging. I wish blueberries grew on Guam. Fortunately, we have to buy them frozen, right?
But we buy them frozen, but we have the biggest berry, which is the papaya. Papaya is apparently a berry, and we have it freely here, and it's a great way to substitute the blueberries.
Beautiful, and it's good for you at so many other levels. What other things? There was a study on fruit and vegetable juice. In that particular study, there was a 76% risk decrease of Alzheimer's compared to placebo, compared to those who were not drinking it. So we know fruits are very good, vegetables are very good. There's something called polyphenols. It's a type of antioxidant that's found in grape juice. So if you're a fan of Welch's grape juice, by all means, if you want to decrease your risk of dementia, that would be a great way to go. All right, this one's interesting because, the question on spices, is there any spice that actually helps? So there's a spice called saffron. I'm not sure how many are familiar with it. They use it a lot in Middle Eastern cooking. It gives that rice that kind of yellowish red color when you eat at a Lebanese or a Middle Eastern restaurant. So saffron, they did a head-to-head trial, saffron and donepezil, which is the Aricept drug that's used. And saffron was about as effective as Aricept in slowing down the progression of Alzheimer's. I thought that was very interesting. I think saffron's a little on the pricey side, but if you can find it, I'd be putting that on my rice every single day. There is something I did want to mention when it comes to food. There are some neurotoxins. They're called advanced glycation end products. They're called AGEs. AGEs, the highest source of AGEs come from cooked meat. When you cook meat at high temperatures, like barbecue, roasting, frying, pan frying, things like that, this increases the AGEs quite a bit. And in the studies that they've done, they noted that barbecue chicken was the highest on the list. So I just want to throw that one out to our population here from Guam. I know we like our barbecued chicken, our barbecued pork, but these actually have this toxin, this AGE toxin. So if you're going to eat meat, the safest way to cook it would be what's called a moist cooking method, either boiling or broiling versus pan frying, because it's the combination of the high heat and the release of these chemicals from the animal protein.
I know, we came to that era that we don't anymore promote chicken. In the past, we will say, stay away from red meat. But nowadays, we know that chicken or white meat is not much better in terms of causing inflammation.
Correct.
Maybe you can avoid cancer, but the inflammation is there. Chicken is very rich on arachidonic acid, which is number one in stimulating inflammation in your body. And inflammation also has to do something with the memory decline.
Absolutely. Absolutely. Chicken, also the other thing on chicken is that it's the highest consumption of salt in adults between the ages of 25 and 50 is actually chicken. Which is very interesting because the manufacturers of chicken actually inject salt into the chicken because salt absorbs water. And since chicken is sold by weight, they can sell the chicken for a higher price the more salt they put in it. So on top of it being a risk factor for high blood pressure, like you mentioned, it's also a pro-inflammatory food.
There is also something interesting. We don't have as much saffron, even though we do have it, available. But the one coloring that the Chamorro cuisine uses is achote, and you have that, in Puerto Rico and other islands.
Absolutely.
And that colors the rice as well, makes it a little bit more red color, and it also is a great ingredient that decreases the level of inflammation. So this is how we can make it, and God certainly has provided nutrients in Guam that we can use and we can enjoy better health.
Well, I'm glad you're sharing with me because I'm going to go out and buy some achiote, like we say in Puerto Rico. All right, one of the other things I wanted to mention, we'll mention this before our next break, which is coming up, and we haven't really touched on it, Elena, is exercise. And so the exercise we're talking about, it's not just a leisurely walk, around the block. We're talking about we want to accelerate our heart rate a little bit if you're able to exercise and get a little bit of cardiovascular in. So the studies actually showed MRI-proven changes in patients who did cardiovascular exercise versus those who did not. In other words, they got two groups, both of them with cognitive decline or with memory loss, dementia, and those who did the exercise actually were able to have better outcomes when we looked at their MRIs in their brain, which I thought was spectacular.
It is spectacular, and that's why we try to make those that we love and with memory loss to exercise for as long as they can.
We are heading into our last break. That gives us about 15 minutes left in the show. I hope you're learning all the ingredients to buy, just like how I am learning what to buy. We're streaming live on Facebook. Go ahead and leave your comments in the comment section below. You can call in your question on Guam 671-472-1111, in the CNMI 670-323-1113. Text and WhatsApp your question in to 671-686-9999. We'll be right back.
Joy FM, with another word made fresh.
God is not a mortal like me, so I cannot argue with him or take him to trial.
Job 9:32 and 33.
If only there were a mediator between us, someone who could bring us together.
Job's life was turned upside down. His loss, incredible. Yet he spoke his mind.
If only there were a mediator, someone to bring us together.
Job wanted to be close to God. We all want to be close to God. But when God sent that mediator, he was despised and rejected.
But God accepted him.
Do you know the mediator?
Hebrews 9:15 gives us his name.
Christ Jesus is the mediator.
Jesus is our advocate,
Attorney.
intercessor,
Savior.
He brought man to God.
The answer to Job's prayer was Jesus. Another word made fresh.
And we're back with more Total Health. Give us a call with your medical questions. Number to call in Guam is 472-1111. If you're in the CNMI, the number to call is 323-1113. Or you can text or WhatsApp us at 686-9999. Now back to the program.
All right, welcome back. One of the questions that we did receive was, when does dementia occur? When are you at highest risk for developing it? So most cases of dementia and Alzheimer's are diagnosed in your 70s. But it's important to remember that deterioration of the brain happens before that. So just to give you some rough numbers, between the ages of 75 and 85, about 1/5 of the population will develop dementia or currently has dementia. Once you reach greater than 85 years, it's about half. And that, in my opinion, is super high. We want to do everything in our power to not let that happen. I did have another question here. Someone was asking if there is anything to avoid saying to somebody with dementia.
Yeah, is there anything like once you have dementia, do we have to be careful around that person? We don't want to hurt the feelings of that person, especially they might be frustrated of losing their mind themselves. Like, how can we be more tactful to those one we love, suffering dementia?
That's a very good question. And so let me start off by saying the following. Throughout my career as a physician, I worked as a hospital physician in Texas for many years. And sometimes I would get a patient with a terminal illness, and the family would ask me not to tell the patient that they had a terminal illness. And so, we would deal with that on a case-by-case basis. But I do have to say that ethically, medical ethics state that the patients have the right to know. If it's someone battling with this, we're obligated to tell them, either we or the family, that they have the disease, even though sometimes we don't want to, but we're obliged to do it. Now, in response to the question, more specifically, we need a good degree of patience when we deal with this. Not too long ago, I was interacting with someone who did have dementia. It was a family gathering, and she would repeat the same question to us every 5 minutes. And every 5 minutes, it was the same question. And, you just have to smile and answer the question and pretend and tell yourself that you're answering it for the first time each time you do. So, let's remember, we here at Joy FM, we here in Guam SDA, we promote a godly atmosphere, right? So from a religious standpoint, from a spiritual standpoint, how can I treat that person better? How can I respond to someone? And one of the things is not saying something overly negative to them and supporting them. Trust me, if they're aware of it, it's hard. It's the hardest thing they've probably ever had to go through. So we need patience, we need humility, and we need to ask God for help.
We do need help. We also, and carers, they also need help, because that person that you're, it's very close to you might not be there to respond the same way. And so we also, as carers, have to find a way to find our outlet and, and still continue building our brain function, exercise, and be our best for, our beloved ones. Not long ago, I think less than a year ago, the University of Guam with Dr. Tuado and the whole team, they organized meetings in which they were seeking, support from religious leaders in Guam, Baha'i faith, the Catholics, also Seventh Adventists, and we all try to give our, ideas how we can care better for those patience, because it is really not easy, and one person should not never feel that they are alone in that battle. You
Right.
know, the more people we can be there for them, the more support we can give, the better. And actually, God does not leave us in our most difficult times.
Right.
God is the closest to us in those moments. And it says that when we don't actually see God, when we don't understand why God is, silent about many things, when we're hurting that our loved one is not the same person, actually it means when you don't see God, it is because He keeps you closer to His heart. God keeps you so close to His heart, and He cares about everything that you're going through. As we were thinking about how we can give those good ideas to those that care for people with dementia, I came with some insight, and I believe it was God inspired. Many of the people that do have dementia, like age of 75, 80, and above, they have gone through the difficult time that they have witnessed the occupation during the war. And in a way, some of those memories have been very, very painful. So God also has a way of, wiping down that pain, from their memories, from everything, and just let them even, having less pain in their last years of their life, not thinking about that, and actually really concentrate on other things. Even if it's that just going outside of the bed, going to the garden and back. So God is in everything, and He can turn any situation, even though if it's the most painful situation, He can turn it into something meaningful. Those are actually the moments when you have to take care of somebody losing their mind that brings you really closer to God. If everything was all right in our life, would we need God? Would we turn to God? If God was giving us everything that we need, we would feel so comfortable that we wouldn't even crave for a better place in heaven. We will be just so content. But there are many things that are reminding us that this is not our final home. There is something much better for us. And even it seems that the life of someone is, it's kind of almost over, even though they're present here, but cognitively they are not here. God has even amazing plans for us, more amazing. He has mansions in heaven, and He's preparing them exactly the way we like it. With our minds and our heart. And it is not a lost battle, even though it seems like it. We can prevent it. We can do everything possible. Once it knocks on our door, we can support it. We can try to learn from that experience. I believe people that take care of patients with dementia, they really becoming closer to God, because in some moment they realize that there is nothing else that they can rely on. That person is not there to help them anymore, but God is right there. In those moments, you become closer to God. You study the Word more. You try to find what's the will, what's God's will in all that, and how you can actually benefit and better your own character in a way that one day, you can find yourself and those that you love in heaven. There are many good spiritual, moral lessons that we can learn even from the worst situation. And I have seen that the worse the situation in your life, actually, the better the story and the greater the glory of God. You're not alone there. God is right beside, and He is holding you close to His heart. There are many amazing Bible verses that can encourage us when we're going through those difficult moments. One particular verse that I like, it says, "Be still and know that I'm God." Many times we say, what can I do? Whatever I do is just not good enough. And I'm just, tired of going over and over and over with different ways of caring for my beloved ones. And it doesn't seem that it really amounts to something. Be still and know that God is right there for you.
So I'm glad you mentioned all of that, Elena. And I wanted to mention something. Over the course of my career, I've taken care of a lot of patients with dementia, different types of dementia, and usually in the hospital setting. And I have found, just based on personal experience, that they like it when you offer to pray with them. You know, for many people, you know, they may be agnostic, they may not want you to, but most of the patients I've encountered want that because it's something that they remember. They remember, most of them can relate to what a prayer is. They may not remember what their favorite TV show was back when they were a kid, but most of the time you can do this. And I just wanted to, just to piggyback off what Elena said, those of you who are listening, who are caregivers for patients with Alzheimer's or dementia, God bless you. You are doing an incredible work. And most likely you do not get the pat on the back that you deserve. It is hard work, it's stressful, and it's not just physically draining, it's mentally draining. And I want you just to remember, like Elena said, just hand it over to God, because at some point, this is bigger than you are. But nothing is bigger than Him.
You know, I heard your talk on prayer on Saturday, and it was very profound. So I'm going to put you on spot, Dr. Santana. Let's pray for the carers. Let's pray for everybody that it is, you know, struggling with that, because there is power, and God is out there looking how to help you and how He can lift your burden.
All right. Well, let's pray. Lord and Heavenly Father, we praise your name, Lord, for giving us this opportunity to share this information. There's people listening. Some may have dementia. Some may care for people with dementia. Some may just never want to ever have dementia, want to know what they can do. And Lord, each individual case is different, Lord. But one thing I know, you love every single one of us. And I put our listeners, I put them in your hands of love, Lord. May you just express yourself to them in a loving way. And we thank you so much because Jesus did die for each one of us. I put them all in your hands. In Jesus' name, amen.
Thank you, Elena, and thank you, Dr. Jared Santana. And thank you, listeners. Tune in next Wednesday for more Total Health.
Be sure to check with your doctors before making any sudden life changes discussed today. Total Health is brought to you in partnership with Guam Seventh-day Adventist Clinic, where health is their mission. We look forward to seeing you next Wednesday. Thank you and si Juas Masi for listening to Total Health right here on Joy FM.